Hi, friends. Tonight, we honor the pioneers who stood up in the earliest days of the epidemic, when fear and stigma were at their highest. We're joined by Dr. Larry Leahy, whose decision to treat people living with HIV nearly 40 years ago was an act of both professional integrity and profound humanity. I know that makes you uncomfortable. Hi, Larry. What was it like to learn about HIV and AIDS 40 years ago?
I was in a particularly fortunate position. HIV was coming around, or AIDS was developing. I was in dental school from 1981 to 85, and that's when all the information was being collected. And so we were very current, and to this day it has proved that they were accurate on what was going on and the difficulties with treating a retrovirus and the transmissibility. What's
Transmitted.
What?
Transmitted.
Transmission. So, anyways, it was a fortunate to have that. So when I came in to the practice, I had a knowledge of HIV and an accurate one.
Yeah. So, how and why did you decide to open your practice to patients with HIV?
Well, another pivotal point in my dental school was we had ethics classes, and they were on Friday afternoon and somewhat spottily attended. But one day, absolutely life-changing, a kid stood up in the back, a classmate stood up in the back and said, we don't have to treat gay people, but he used an F word in a thing, and it was really alarming. And so anyways, the professor at the time was, without missing a beat, came in very cool, calm, and collected and said, you don't have to treat anybody you don't want to treat. But what you don't know is you don't know who's gay. You don't know who's out there. You don't know how they present themselves. And so you don't have a clue on that. And first of all, the thing you need to realize is that we take universal precautions to protect ourselves, protect our patients, and protect our staff. And if you had the idea that there's something different or more dangerous about treating an HIV-positive patient, you're wrong. The idea is that this is a virus that can be killed with soap and water. It dies when it's desiccated. When it comes outside the body or whatever, it doesn't get transmitted. So if you can't protect yourself, protect your patients, and protect your staff, you have no business practicing dentistry.
Yeah, it's huge. So looking back, do you feel that the profession underestimated or overestimated the risks?
Well, that's also a very interesting point. The same people are telling me to go ahead and treat HIV-positive patients. The dental school at that point was getting some flack about not providing services for HIV patients. So they set up a clinic they would see 2 patients a day. They completely lined the room in plastic. And these are the same people telling me it was safe to do, but at the same time, my justification in my head was they had a liability issue, because it's a teaching institution, so you're putting people at risk, perhaps.
Right. I know this makes you uncomfortable, but I'm going to ask you anyway because I love you and you love me and you'll forgive me. So 40 years later, how do you view your decision now? You made a huge, bold decision to treat people.
I think it's important to, at this point, we were right. We were right. You could do this, and it was no particular great risk.
Right.
And at the same time, there was a lot of, from other professionals, other dentists and so forth, that just wouldn't treat it, and not so much that they didn't have the compassion for the people. A lot of them have been their dentists for a decade, and they just refuse to treat them with the idea that they're putting an unnecessary risk.
Right. Right. And how do you hope your decision will be remembered in the legacy?
Well, just to trust the facts. Medicine is medicine, and what you know is what you know, and to believe in that, and to discount the rumors, the misinformation that seems to be going around, that just, know to believe in what you're taught.
Yeah, I love that. So as we mark 40 years of work by PATF and allies, we're reminded that progress is built on the courage of individuals who chose compassion over fear. Larry, your decision to treat people living with HIV at a time of uncertainty and stigma helped pave the way for dignity in care and trust in medicine. Thank you for sharing your journey and for reminding us that true leadership is measured in humanity.
You're very kind. And thank you, Carrie, for making it short.